Hello everybody, this is group 3 for clinical patho. Our group is gonna have a forum about pneumonia in cats, and these are the group members: Megat, Annie, Tasneem, and Stanley. Everybody can introduce themselves. My name is Tasneem Brnawi, and my matric number is 191399.
My name is Noraqilah with matric number 192180.
My name is Megat Hisyam and Megat Azamuddin with matrix number 192120.
And I'm Stanley with matric number 194276.
Next are the outlines of our topic. We're going to talk about, we're going to give brief introduction about pneumonia in cats, and then we're going to have a case review to help us explaining more about pneumonia in cats. Third is discussion, and the last one is conclusion to just wrap up all the information we mentioned during the forum. For the introduction, we just need to define what's pneumonia. It's basically inflammation of the lungs and airways that cause breathing difficulties and deficiency of oxygen in blood. The causes of pneumonia might vary from one case to another, but we have here summary of agents or what can cause pneumonia. Like for viral pneumonia, it can be caused by calicivirus and herpes virus, infectious peritonitis virus. And for bacterial pneumonia, it's caused mostly by mycoplasma and bronchispectasia and Pasteurella. For mycotic pneumonia, it can be caused by Cryptococcus, Histoplasma, and Aspergillus. Parasitic pneumonia is caused by Cavillaria and Abstrosis and Paragnias. And lastly is protozoa, is caused by Toxoplasma. Next is clinical signs. Can just somebody give us a brief or some information about clinical signs in pneumonia?
Yeah, for the clinical signs, we managed to see this from these cats, which include breathing difficulties, and these difficulties is shallow, labored, or rapid breathing rate, and also show coughing, loud respiratory sounds, which is rattling sounds, and there is also exercise intolerance, fever, lethargy, nasal discharge, reduced appetite, and lastly, this can also show weight loss.
That's good enough. For the case review, we need to look at the signalement. Well, we know before that looking at the signalement is pretty important, including history, because it's going to give us or it's gonna narrow down our differential diagnosis. Plus, it's gonna give us a brief idea about the severity and about the emergency situation of the cases. But here in this case, can somebody talk about the signalement specifically in this case?
Oh, so for the signalement of this case, the species is feline and is 5 years old, is a neutered male. Its breed is domestic short hair cat and it weighs 6.7 kg and has a quite good body condition score 4 out of 5. And for the management, this cat is an outdoor cat and it has been treated since 3 years with Megastro estate because this cat has eosinophilic keratoconjunctivitis. Yes.
For the about the age, what do you think about this age? Do you think it's related to age, pneumonia, or other problems?
Pneumonia?
No, I
Uh,
mean, do you think this cat is old or it's a young one, or what do you think?
this
From my opinions, the cat is 5 years old. For me, it's quite old. And as we know, in older cats, in older animals, they are prone to have they are prone to have more diseases than younger animals. So these cats can we have to see the history of this cat, and we have to see the clinical signs that this cat develops in order to diagnose what is the disease that this cat is experiencing.
That makes sense. Plus, I think for the management, when the cat is outdoor, it means it's suspected to other agents like we mentioned before, the viral and bacterial. Okay, good enough. History?
Okay, for the history, as we can see in the signal, this cat have been treated with megaspore acetate for the past 3 years, which in 8 August of 2017, because this cat developed eosinophilic keratoconjunctivitis, so it have to be treated with megaspore acetate. And then at 12 March 2020, this cat is presented at a clinic with developed nasal crust, sneezing, and stutter. This cat also experienced polyuria, polydipsia at this point of time. And then after about 45 days from the first checkup, this cat is presented again at the clinic with clinical signs of lethargy, inacceptance, and cough. And hypothermia also have been observed during these physical examinations. And then after the last checkups that this cat is presented to confirm the bacterial culture and the PCR for the public reasons in these cases. For the physical examinations, in the first checkups, as you can see, the temperature is 38.1 degrees Celsius, and the heart rate is 190 beat per minute, and the respiratory rate is 40 beat per minute. The TPR rate is actually quite normal. It's all of the TPR value is in a normal range, but the cats show a clinical signs such as stertorous breathing, erythema, crusting on nasoplenum, and retromandibular lymph nodes enlargement. So further diagnostic plans have to be made in order to diagnose this cat. As you can see, from the clinical signs, the stertorous breathing and erythema, the differential diagnosis that we can conclude is this stertorous breathing erythema usually caused by respiratory disease. So we can say the cat might have bronchopneumonia or feline bronchitis caused by bacteria, allergy, or idiopathic reactions. So for diagnostic plans to rule out the respiratory disease, the CBC, serum biochemical urinalysis results, we have to interpret all of these results in order to find out if it's bacteria or any parasite infections and such what. Okay. Next, for the retromandibular lymph nodes enlargement, usually retromandibular lymph node enlargement is caused by virus infections. So for the differential analysis, we highly think that the retromandibular lymph node enlargement is caused by feline leukemia virus or feline immunodeficiency virus. Okay, and the diagnostic plans in order to rule out this virus, we can do the enzyme link immunosorbent assay for feline leukemia virus and feline immunodeficiency virus. We can also do fine needle expressions at the retromandibular lymph node in order to find out what is the morphology of the cell in the lymph node. And next, can you move the? Okay. Next for the class. Okay, it's okay. For the from the next okay, from the hemogram for the first checkup. Okay, as you can see, the leukocytes number is slightly increased, which indicate leukocytosis, which could be due to inflammations or infections. And we can also see neutrophilia, which also can also indicate toxic changes or left shift. It may due to inflammations or infections also. We can also see monocytosis that could be also from the infections. So from the CBC, the animal we can say it is from the infections due to parameter, but there is no significant findings or that we can conclude that this is bacterial infections or virus infections. But from the biochemistry results, we can see the glucose is remarkably increased, which indicate hyperglycemia, and the triglyceride is also very increased, hypertriglyceridemia, and fructose is also very increased. We can see the increase in fructose and concentrations. All of these biochemistry results shows that the animal might have a diabetes mellitus, and the urinalysis result also shows that this cat has severe glycosuria and high ketonuria. So which we can say that this cat might have diabetes ketoacidosis because the glucose and the ketone is remarkably high, and the cat have a low concentrated urine specific gravity, which actually is not normal, because if these cats have high glucose level, the urine concentration, the specific gravity should be higher than 1030. So if the specific gravity is only 1020, we could say that this cat might have a underlying kidney disease. In fact, underlying kidney disease that leads to the glucose that lead to the diabetes mellitus. Okay, next slide.
Okay, the diagnostic plan during the first checkup was after the CBC was done, the cat was also being tested with enzyme-linked immunoglobulin assay, ELISA, for FIV and feline leukemia virus, and the result was negative. And then the cat was being done with fine needle aspiration from the nasal lesion and the retromandibular lymph node. The cytological feature showing eosinophilic inflammation and also reactive lymphoid hypoplasia, respectively.
Okay, from the first checkup just now, we can conclude that this cat might actually have diabetes mellitus that caused the clinical signs to appear. And then for after treatments for 45 days, the cat has been presented again for second checkup. So in this second checkup, the cat temperature is 40.1 degrees Celsius, which is quite high for feline species, which indicates hypothermia, and other TPR value is actually in a normal value, and this cat shows clinical signs of lack of appetite, lethargy, and cough. So next slide, please. Okay, from the clinical signs, the first is cough. We can see that this is could be by respiratory disease. So from the history we have to check back from the Pneumonia and feline bronchitis in order to rule out if if there any possibility to have this cat is having this disease, and the lack of appetite and lethargy might be due to the first problems, and lethargy might be due to the cats not been eating, so it doesn't have energy. And this are some diagnostic plan that we could do in order to rule out the disease for respiratory disease in this cat. Next slide, please. Okay. From the hemogram for the second checkup, the complete blood count and the serum biochemical profile were unremarkably, and there was no significant findings for the test. So we have to do more. We have to perform further diagnostic tests to find the cause of pneumonia, such as X-ray of the lungs, in order to find out if there are any infections or any disease of respiratory disease.
Okay, so continue with the diagnostic plan during the second checkup. Because the CBC was unremarkable, so further diagnostic plan was being done, which is thoracic radiography. Inside the thoracic radiography can be seen a multifocal nodular interstitial infiltrate. And then ultrasound guided fine needle aspiration was done. In the cytological smear of the fine needle aspiration sample, we can see highly cellular with neutrophil and macrophages representing pyogranulomatosis inflammation in the interstitial infiltrate. So under high power field resolution, there is rod-shaped bacteria being observed in the cytoplasm of the macrophages and the neutrophil. So FNA was done again to culture the bacteria. So the bacteria culture found that the isolation is actually Salmonella serogroup B. And then another test was being done, which is Biermann fecal examination. This is to rule out lungworm infection because the result was negative. And then antibiogram was also done, which shows that the cat is susceptible to most of the antibiotic tested. After that, PCR was done to confirm the Salmonella species, which is a positive Salmonellosis, and also another PCR was done to confirm Salmonella serogroup B to Serova tymphimurium, which is very common in cat, but it is actually negative. So the diagnosis being done here, we can say that the cat has bacterial pneumonia, which is caused by Salmonellosis. So here is the X-ray done. So the first one on the left is left lateral and the dorsoventral on the right. The chest radiograph obtained during the presentation. Multiple widely distributed nodules. The whitish color in the lung area. Nodules of varying size can be identified throughout the lung field. This is the whitish part of the lung. This is the nodule. Then the next one is detail of the dorsoventral view. The arrow shape show here is the subpleural nodule from which the FNA being performed. It is taken here 2 times. For the first one is for the checking of the cytological smear, and then the second FNA was done for the isolation of the Salmonella serogroup B. And then in the cytological smear, from the fine needle aspiration of the pulmonary nodule, we can see numerous markedly degenerated neutrophil associated with large foamy macrophages are present. And then the cytoplasm of some macrophages here contain phagocytized neutrophil and bacterial rods. So in this slide, we can see there is bacterial rods. This is the Salmonella. Then during the third checkup, which is after being done treatment and all, the third checkup is for public health reason. which is 4 weeks after the diagnosis. So bacterial culture is done again, and the cat is negative from Salmonella, and PCR is done from the oropharyngeal and rectal swab, also negative from Salmonella. So the cat has already healed during this time.
Coming to the treatment part, there was different treatment plans for every for every condition. Like for example, for eosinophilic keratoconjunctivitis, they use migastrol acetate as anti-inflammation, and for diabetes mellitus they use insulin, and just like to narrow down the problem list. And then for eosinophilic granuloma, they had to use cyclosporine because the other one, which is migastrol, was stopped because of the diabetes. The patient can be treated with migastrol when there is diabetic condition. That's why they had to change the treatment plan with cephalosporin. The last thing is salmonellosis. They had to treat it with doxycycline, which is broad antibacterial antibiotic. For the prognosis was good because as we know, like for these treatment plans, they had to treat it one by one, and whenever the cat shows a good condition, they would go to the second plan. Then the pathophysiology.
Okay, since we have this diagnosis result, now we have come up with pathophysiology that we can explain the mechanism. And so for this pneumonia, we can explain it, we can track back from the previous treatment, which is the cyclosporine for the previous treatment. And this administration of cyclosporine has causes immunosuppression. Since Salmonella is a common bacteria that infect the intestinal tract and is uncommon for the respiratory tract, its invasion is uncommon. Normally, the intestinal tract is protected against Salmonella species colonization, and infected cats with normal defense mechanism normally will have transient or no clinical symptom. But in this case, since there is the administration of cyclosporine, it is suspected that it has caused immunosuppression. And the subclinical, the latent shedding of this Salmonella, which previously got infected via the airborne transmission route, get reactivated. And this Salmonella SP escape the host immune defense and causes bacteremia, and use the bloodstream as a medium. This infection reach the lungs. And next slide, please. And so when this Salmonella bacteria reach the lungs, it initiates the inflammatory response, which includes those nodules we have in previous slides that we can observe through the radiograph. And it proceeds after the inflammation. We will have, it's common that there will be alveolar edema and exudate formation. This will cause the alveolar and respiratory bronchioles to be filled with serious exudate blood cells, fibrin, and bacteria. And the end will be the consolidation of lung tissues, which is from here we can see how the Salmonella eventually bring this pneumonia to this cat in this case?
Again, depending on the treatment plan and the pathophysiology, the prognosis was considered as good. For conclusion, does anybody want to conclude what happened in this case?
I can. So, first, when the cat was administered with the megastrol acetate during the first time from the history, this megastrol acetate is to treat eosinophilic keratoconjunctivitis, which is a disease the cat have previously before the cat came in with the stator breeding and all. So, this megastrol acetate causes diabetes mellitus. So diabetes mellitus was treated with insulin glargine. So when the diabetes mellitus has already healed, cyclosporin replaced the megastrol acetate for treatment for the eosinophilic granuloma complex. So having diabetes mellitus and also cyclosporin administration at the same time, this causes immune suppression by reducing the T cell response. This favors the infection of Salmonella species. So the administration of cyclosporin was discontinued and no recurrence of eosinophilic disorder, and it is being replaced by doxycycline administration to treat the salmonellosis. So the root of infection might be airborne, as salmonellosis is actually related with GIT problem instead of respiratory problem, because salmonellosis usually come from consumption of contaminated food. So that is actually the conclusion of this whole case of the cat.
So far, so good. Actually, it was a good case with a good team to explain the whole case. And this is greeting from me, Tasneem Brnawi, and Group 3 of Clinical Pathology. Thank you, everybody, for presenting this case.